Hi, everyone. I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today, I would like to talk to you about an idea that often I hear in transgender community, actually, and online transgender groups. And I'm not saying that it's prevalent in all of the transgender online groups. It is not, but it is quite common. And a lot of you have heard this before. It's this idea that transgender identity, to identify as a trans person, one must go through medical and surgical transition. Otherwise, if you have not gone through medical and surgical transition, you cannot claim and own the term transgender, if you will, because you have not gone through all of those things. Now, I know that a lot of you watching this know and already familiar with the idea that obviously medical and surgical transition is not a necessity, it is not mandatory. And yet I keep hearing and I keep seeing a lot of this discussion. Just recently, I posted a short on my Instagram talking about how medical surgical transition is not necessary. And somebody commented underneath of that video. So it's still very, very common. I still see sometimes people will send me videos or commentary from trans people themselves who are making short segment videos where they're talking about the fact that unless you're going through surgery or modifying your secondary sex characteristics through hormones, at least, you cannot call yourself transgender. And I really think this is not only inaccurate, I also think that this type of concept, this type of discussion is very limiting and potentially very harmful to individuals who identify as transgender. And so today I want to talk about that. And on top of that, I want to share how that actual, this concept, this idea that you hear breeds so much anxiety in trans-identified individuals. So we already know that if you identify transgender, that is your core stable sense of identity, or it can be mutable as well. Not everybody's core identity tends to be stable over the time or fixed. It can absolutely be mutable, but it's how you identify, how you feel on the inside. And of course, for the individuals who are struggling with gender dysphoria, there is going to be an incongruency that they're going to feel with at least some or all aspects of the secondary sex characteristics, because their body is still being gendered in today's society. And as long as the body is being gendered, you're going to experience dysphoria, because that gendering of the body is going to put you at incongruency with how you actually feel on the inside. So for that reason, it is natural, almost unavoidable, to experience physical dysphoria. That sense of physical dysphoria oftentimes does lead individuals to consider medical or surgical transition for that reason, to align yourself to feel much more congruent. So a lot of people do seek medical and surgical interventions as adults, and that's a valid option. However, there are also a lot of individuals today who are starting to realize aspects of their gender, also starting to realize how much our bodies are being gendered every single day, who also realize that they know who they are and they may not necessarily want or need those surgeries in order to fit again into any kind of particular gendered mold. A great example is, for example, trans women who are very comfortable, some trans women who are incredibly comfortable with their genitals and do not desire vaginal surgery at all. Well, some people in trans community may point out and say that you're not really a trans woman unless you have that surgery. Some outside of trans community may even say that you're not even a woman unless you have the surgery. All of which I think is very, very inaccurate and just a projection, really, of those individuals' views on what gender is and what gender means to them. So we know that many individuals not even seeking any surgeries, many individuals may not even consider some things. Some people have a spiritual internal connection to their gender and may not even desire surgeries or medical treatment. And that's incredibly valid and very important to realize. What I think becomes really harmful in a way is when we perpetuate an idea that transgender identity equals medical and surgical, equals medicalization and modification of your body. Again, I am a strong supporter of gender-affirming care for people who need it. Very strong supporter of gender-affirming care. What I'm not supportive of is having this black and white mindset where one equals this. I know a lot of people who decided and they feel they need to go through medical and surgical transition, and I want them to always have access to the care. And I also know a lot of people who feel like they're feeling a little bit pressured because even the community itself is pointing out to them that you're not unless yada, 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 yada. And I don't think that's fair. And I don't think that's very helpful or safe or mindful, or in the very least, it is incredibly reductionistic of your complexity of your gender identity. So as I always say, and I will always preach the same thing, being trans-identified person does not equal you must go through medical and surgical transition. You can, of course you can, and I want you to have access to that. And I really wish that our legislators and across the world, not just in the United States, would have access to affirming care for all adults. At least I work with adults, accessible to them so that you can have it if you need it. But I also want people to be careful not to get stuck in the cycle of idea when you hear somebody telling you in a community or outside of communities that you must have it because you are transgender, because that is just really, really not true. How does it now breed anxiety? Because I see so much anxiety, rumination, obsessive thinking that I see this type of mindset breeds. When you are a trans-identified person, and when you are especially living in a world where your access to surgeries or medical treatment is not accessible to you, if you also really want it and desire it and need it to alleviate your dysphoria and distress, on top of that, you're also hearing commentaries that tells you that you must go through all this in order to be accepted in the transgender community tribe. That is going to breed a lot of anxiety in you. You're going to feel like you're missing out on things. You're going to feel like you can't be part of a community unless you actually go through those procedures. And those procedures may be years in terms of planning for you, depending where you are in the world or depending on your access to resources. And that type of anxieties then further slips into depression, sinks into despair, and it becomes a very painful sort of existence because you chase that which is just perpetuated by community. Now, on the other hand, if you are living in a part of the world or anywhere and you desire medical and surgical transition and you know it's going to help you alleviate distress and you're waiting for that care of services to be offered, or maybe in your waiting list for the care of services, and you have also communities that support you, that also tells you things such as, okay, I see that you're waiting on this over here. In no way you not having the services negates the fact that you're trans. Take this opportunity, take this time to enhance your social system, enhance your support system. Take the time to work on your internal sense of self, on your internal relationship to yourself. Well, now you're not bombarded by all of this ideas of how you ought to be. Now you have room to explore. Now you have room to offset that anxiety and the despair in waiting for the services and focus on yourself. I think for a lot of adults that I see, fortunately, because you're adults and you're very mature, when you hear somebody saying you're not until this, it's a little bit easier to realize that these are projections of other people, or to realize that there's so much more to use than just surgeries or medical interventions. But for young adults, sometimes that I see between age 18 to 25, I still see this mindset. And sometimes young adults do ask me this, now that I identify as transgender, which surgeries do you think I should go through? And my answer is, it's not what I think. It's not for me to decide. It's also deciding what is the surgeries are going to do in your life. What is it going to alleviate? How is it going to help you? How is it going to make your life much more painless? That's what I look at. But I don't want anybody to go through surgical medical intervention because they heard online or they heard on communities that you're not trans unless you do this. This is the worst message any of us can send to anybody who is trans-identified, is that if you're trans or non-binary, you have to have the surgeries. You must modify your body to fully fit the concepts and the labels of particular gender concepts. And it's really just not only perpetuating gender stereotypes, actually, in a way, but it's also very limiting in the whole scope of our gender expression, our gender identity. And the amount of anxiety it breeds is ridiculous. Think about transgender individuals who are, because of the medical conditions, because of some other serious things, the circumstances in their life, maybe they live in a part of the world where there is no even care, or if there is care and if they were engaged with care, it would be completely unsafe for them. And imagine these individuals hearing messages that you're not trans unless you actually go through all of this gender affirming care. imagine what it does to their sense of self. That is very devastating and very unfair. And I don't think that not going through any of this is in any way, again, negates your sense of identity. Your sense of identity is internal. A lot of people do external things which are helped by surgeries, gender affirming surgeries, and helped by hormones in order to modify the secondary sex characteristics that are giving people so much dysphoria and so much pain. But some people have less of a pain. Some people don't even have dysphoria about some parts of their secondary sex characteristics, and for that reason, don't even feel like they need to go through all of this modification. So again, it is so individualistic. I cannot stress out how decision in terms of which surgeries, if any, are for you is so personalized. Deciding on hormones is so personalized. It is not a cookie cutter approach. This equals this. It has never been a cookie cutter approach. And the more we talk about the fact that it's not a cookie cutter approach, the more we allow the room and possibility for people to explore other options, and also to realize that there's other things beyond just medical and surgical options. There's also things about inner works. There's also things about inner spiritual work. There's other aspects of things as well. So it's really, really important. I know that I'm probably preaching to the part of you, of my audience, or preaching to the choir, but I hear this to this day, and I get so frustrated that you're not trans unless you go through surgical and medical, and it is absolutely not true. Absolutely not true. Don't let anybody to dictate it to you. You have to decide what's best for you. Comment below. Let me know. Do you still hear this in transgender communities? Do you hear that you have to go through all of this? Do you feel like the narrative in the community is changing? How has that affected you when you really discovered your essence, your identity? How did it affected you in hearing that you have to go through all of that? How did that, and what impact it had on you? Comment below, let me know. I love reading all of your comments, and I will see you all next time. Bye.